Have you ever wondered how many elderly people receive a dementia diagnosis while you watch this entire video? The answer might shock you. Roughly 18 individuals every 70 seconds. But here's what's truly alarming. The root cause might not be natural aging, but something sitting right in your medicine cabinet. You've been assured these medications are harmless, routine, even necessary for your health. However, groundbreaking research is now revealing a disturbing truth. An estimated 97% of seniors remain unaware that at least one prescription they're taking daily could potentially reduce crucial brain regions by up to 32% within just 10 months. The pharmaceutical industry has been aware of these connections for years, yet continues generating massive profits from medications that may be contributing to cognitive deterioration in countless older adults. A recent 2024 study published in Brain Health and Aging found that a specific category of drugs elevated dementia risk by 52% in elderly patients within just 18 months of regular use. In today's discussion, we'll expose the 9 most concerning medications linked to accelerated memory decline and cognitive impairment, ranked from commonly overlooked to potentially devastating. Number 3 on our list is prescribed to millions for seemingly minor conditions, yet it may be silently compromising your brain's memory canters without any obvious symptoms. Before we begin, please share in the comments, which daily medications are you currently taking? Have you experienced any unexplained mental fog or memory lapses recently? Medication number 9, diphenhydramine. Diphenhydramine, commonly found in popular sleep aids and allergy medications. This pink tablet has earned the trust of millions seeking better sleep, allergy relief, or cold symptom management. It's affordable, readily available over the counter, and probably occupies space in your nightstand drawer right now. While you might believe you're simply addressing sleep issues or seasonal allergies, diphenhydramine is actually interfering with your hippocampus, the brain region crucial for forming and storing new memories. This medication belongs to a drug family called anticholinergics, which block acetylcholine, a vital neurotransmitter responsible for memory formation and mental alertness. As our brains age, they become increasingly dependent on every molecule of available acetylcholine. When medications interfere with this delicate process, the consequences can be severe. A 2024 study published in Cognitive Health and Geriatrics revealed that seniors using anticholinergic medications regularly faced a 58% elevated risk of developing dementia compared to non-users. How can you safeguard your memory? Start by avoiding products containing diphenhydramine, particularly those labeled as PM formulas, nighttime versions, or allergy relief combinations. These often contain the same problematic ingredient in different packaging. For allergy management, consider newer non-drowsy alternatives like loratadine, commonly available as brand name products, which don't penetrate the blood-brain barrier and pose significantly less risk for long-term senior use. Remember, never discontinue medications suddenly, but also never assume over-the-counter equals safe. Next up is a medication often promoted as gentle and stomach-friendly, yet it can block essential nutrients your brain requires for optimal function. Medication. Number 8, omeprazole. Acid reflux medications. Popular medications like those containing omeprazole or esomeprazole belong to this drug class known as PPIs. These medications work by reducing stomach acid production and are frequently prescribed for heartburn, GERD, and acid reflux symptoms. Many seniors remain on these drugs for years, sometimes decades, because symptoms typically return when discontinued. What's rarely discussed is how PPIs interfere with vitamin B12 absorption, a critical nutrient that protects brain function and supports memory, concentration, and emotional stability. Research from 2017 published in Neurological Health Studies examined over 76,000 individuals aged 73 and older, discovering that regular PPI users showed a 47% increased dementia risk compared to non-users. By overly suppressing stomach acid, PPIs disrupt the body's ability to absorb not only B12, but also magnesium and calcium, minerals essential for neural communication and brain cell function. Without adequate levels, neurons struggle to operate efficiently, leading to misfiring, confusion, and memory gaps that often resemble early Alzheimer's symptoms. The problem extends even deeper. PPIs have been linked to increased levels of amyloid beta plaques in brain tissue, toxic proteins that interfere with brain function and are considered a primary driver of Alzheimer's disease. Fortunately, safer alternatives exist. If you're taking a PPI daily, consult your physician about gradually tapering off with assistance from H2 receptor blockers like famotidine, available under various brand names. While not perfect, H2 blockers are less likely to impact cognitive function. Additionally, deglycyrrhizinated licorice, a natural compound that coats and soothes stomach lining, can provide symptom relief without cognitive concerns. Our next medication is commonly prescribed for bladder control issues, but it may be causing significant damage to both short-term memory and emotional regulation. Medication number 7, Ditropan. Bladder control medications. Oxybutynin, available under brand names like Ditropan, is frequently prescribed to seniors struggling with urinary incontinence or overactive bladder symptoms. On the surface, it appears to be a practical solution. Nobody wants to manage the embarrassment or inconvenience of frequent bathroom visits. However, this medication operates by blocking acetylcholine, the identical brain chemical disrupted by diphenhydramine. Unlike milder anticholinergics, oxybutynin crosses the blood-brain barrier more readily and directly affects memory regions within the hippocampus. This makes it particularly hazardous for seniors, especially during extended use periods. A 2020 study published in the British Medical Journal found that adults over 65 taking strong anticholinergic medications like oxybutynin for more than 12 months faced a 51% higher dementia risk. That's essentially 1 in 2 people. What makes this more troubling is that many seniors never receive warnings about cognitive side effects. They're simply told it will improve bladder control, not that it might accelerate mental decline. The resulting harm is often dismissed as normal aging. Patients report feeling mentally foggy, forgetting appointments, misplacing belongings, or suddenly struggling to follow conversations. This decline is rarely connected back to the medication until significant damage has occurred. If you're taking oxybutynin and have noticed mental changes, you're not imagining things, and you don't have to remain on this drug to maintain control. Newer medications like mirabegron, sold under brand names like Myrbetriq, work through different mechanisms and demonstrate significantly less memory impact. These alternatives don't block acetylcholine and are generally considered safer for older adults. Medication number 6, statins, cholesterol-lowering drugs. These medications rank among the world's most widely prescribed drugs, particularly for individuals over 60. They're designed to lower cholesterol levels and reduce heart attack and stroke risks. Simvastatin and atorvastatin, available under brand names like Zocor and Lipitor, represent the most common varieties. But here's where complications arise. Cholesterol isn't merely a cardiovascular concern, it's a brain necessity. Brain tissue consists of nearly 60% fat, and cholesterol plays a crucial role in creating and maintaining myelin sheaths, protective coatings that enable smooth nerve signal transmission. When you aggressively reduce cholesterol, you may simultaneously deprive the brain of essential components for proper function. A 2024 study published in Advanced Aging Neuroscience found that seniors over 72 who had used statins for more than 4 years showed a 29% higher risk of mild cognitive impairment. Those on higher doses experienced even more pronounced declines. What's particularly concerning is that some patients report sudden onset memory loss, describing episodes where they couldn't recall names, recent conversations, or familiar driving routes. It's important to understand that not all statins affect the brain equally. Some varieties like pravastatin and rosuvastatin don't cross the blood-brain barrier as easily and are considered less risky regarding cognitive side effects. If you've been taking statins for years and noticing fog, forgetfulness, or confusion, it might be time to discuss dose reduction or alternative strategies with your physician. Don't wait until changes become irreversible. Early action provides the best chance of protecting your cognitive function for years ahead. Medication number 5, anti-anxiety medications, benzodiazepines. This drug class includes medications like lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax. Some of the most frequently prescribed treatments for anxiety and sleep disorders. They function by enhancing GABA, the brain's calming neurotransmitter that reduces overstimulation. Initially, these medications seem like miracle solutions. They quiet racing minds, ease panic attacks, and promote sleep. However, over time, they transform into something entirely different, a cognitive trap. A 2023 study published in the British Medical Journal tracked over 9,200 seniors across a 7-year period, discovering that individuals who used benzodiazepines for more than 4 months faced a 54% increased Alzheimer's disease risk. The risk climbed even higher for long-acting varieties like diazepam, which remain in the body longer and accumulate in fatty tissues, including brain tissue. What occurs is a form of chemical sedation that slows neural activity. This means your brain stops learning efficiently. It becomes less adaptable, less efficient, and more susceptible to confusion, memory gaps, and emotional numbness. Seniors taking benzodiazepines often describe feeling mentally foggy, disconnected, or unlike their true selves. The worst aspect is withdrawal. When attempting to stop, symptoms like anxiety, agitation, and insomnia can be severe, making the medication feel essential when it's actually the source of the problem. To address this situation, if you've been taking a benzodiazepine for more than several weeks, never stop abruptly. This can be dangerous. Instead, collaborate closely with a physician to gradually taper the dosage. Alternatives like buspirone, a non-sedating anti-anxiety medication, or cognitive behavioral therapy for insomnia and anxiety can help restore calm without causing memory loss. Medication. Number 4, tricyclic antidepressants, amitriptyline. Number 4, amitriptyline, available under brand names like Elavil. This older antidepressant remains commonly prescribed today for pain management, insomnia, and sometimes migraine prevention. At first glance, it may appear to be a versatile solution, but underneath lies one of the most potent anticholinergic medications still in circulation. This means it blocks acetylcholine action, the neurotransmitter that enables neurons to communicate, form memories, and maintain sharpness. In fact, it blocks this chemical so powerfully that cognitive effects aren't just possible, they're virtually guaranteed with long-term use. A comprehensive 2016 study published in JAMA Internal Medicine examined over 3,500 adults aged 65 and older, finding that those taking higher cumulative doses of anticholinergic medications like amitriptyline over a 12-year period had a 57% greater chance of developing dementia. That's not a minor increase. It's more than half again the normal risk. What's terrifying is that many patients never receive warnings about memory-related risks. They're often prescribed amitriptyline for sleep disorders or nerve pain, then gradually notice changes like short-term memory loss, word-finding difficulties, and mental fog. Even low doses taken nightly over several years can create slow, invisible cognitive erosion. The damage occurs silently. No warnings, no initial symptoms, just gradual decline that resembles aging but is actually drug-induced cognitive impairment. Medication number 3, paroxetine, specific SSRI antidepressants. Number 3, paroxetine, commonly sold under the brand name Paxil. This medication ranks among the most frequently prescribed selective serotonin reuptake inhibitors, SSRIs, for depression and anxiety treatment. At first glance, it appears to be a modern antidepressant, supposedly gentler than older drug generations. But here's the critical detail they don't mention. Paroxetine is the only SSRI with significant anticholinergic properties, meaning it interferes with brain acetylcholine. This single characteristic makes it drastically different from other SSRIs like sertraline or escitalopram. A comprehensive 2022 review published in Frontiers in Psychiatry examined cognitive profiles of elderly patients taking different SSRIs, finding that paroxetine users showed measurable declines in short-term memory, verbal recall, and attention span within the first 14 months. The study also revealed that seniors taking paroxetine were 33% more likely to show early cognitive impairment signs compared to those on other antidepressants. The irony is stark. It's often prescribed to stabilize mood, yet ends up undermining mental clarity and emotional regulation over time. The solution here is straightforward but crucial. Avoid paroxetine entirely in seniors. The American Geriatric Society has included paroxetine on its Beers criteria list, medications potentially inappropriate for older adults. If you're currently taking it, ask your physician about switching to safer alternatives like sertraline or escitalopram, which are better tolerated and don't carry the same cognitive risks. Additionally, supplementing with B vitamins, especially B12 and B6, can help support mood naturally. Medication. Number 2, antipsychotic medications. This category is particularly alarming because many seniors don't realize they're taking an antipsychotic drug. Medications like quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa, were originally developed to treat schizophrenia and bipolar disorder. Today, they're frequently prescribed off-label to elderly patients for sleep problems, agitation, or behavioral changes associated with dementia itself. That's correct. Drugs intended for severe psychiatric illness are being used in nursing homes and hospitals for seniors who are simply confused, restless, or difficult to manage. The consequences are devastating. In 2023, a comprehensive study in the Lancet Healthy Longevity followed more than 27,000 older adults, finding that seniors prescribed antipsychotics for behavioral symptoms were 74% more likely to experience worsening cognitive decline within 10 months, even without prior dementia history. Worse, these drugs increase stroke risk, sudden death, and severe sedation, potentially leading to falls, hospitalization, or permanent institutionalization. The mechanism is brutal. These medications suppress dopamine, a chemical linked not only to mood and motivation, but also critical for executive function and memory processing. When dopamine levels crash, the brain becomes sluggish and unresponsive. This explains why seniors on antipsychotics often appear dull, emotionally flat, or zombified. Their personalities fade and family members begin mourning someone who's still physically present. Correcting this situation starts with asking difficult questions. If you or a loved one takes these medications, ask the prescribing doctor why it was ordered and whether it's truly necessary. In many cases, behavioral symptoms can be managed through non-drug interventions, creating structured routines, reducing environmental noise and overstimulation, addressing pain or discomfort, and improving lighting and sleep hygiene. When medications are absolutely necessary, lower doses for shorter periods can reduce harm. More often than not, these drugs are used for convenience, not medical necessity. The tragedy is that many families aren't informed about these drugs' effects. They simply witness their loved one declining without knowing the cause is chemical, not natural. Medication number 1, multiple anticholinergic medications. This represents the hidden danger that virtually nobody discusses, and it's one of the largest contributors to drug-induced dementia in elderly populations. You might expect a single medication to top this list, but the most dangerous threat to senior cognitive function isn't one pill. It's the silent, cumulative effect of taking multiple medications with anticholinergic properties simultaneously, known as anticholinergic polypharmacy. Consider this scenario. A senior takes diphenhydramine for sleep, oxybutynin for bladder issues, and amitriptyline for pain management. Each medication alone might cause only mild memory problems, but together they compound, and the cumulative anticholinergic burden becomes astronomical. This isn't theoretical concern. A 2023 analysis published in Age and Aging tracked over 295,000 older adults, finding that those with the highest anticholinergic burden had a 125% increased risk of developing dementia within 12 years. That's more than double the normal risk. Here's the most disturbing part. Most seniors had no idea they were taking anticholinergic medications. When you block acetylcholine from multiple directions simultaneously, your brain doesn't just slow down, it begins to deteriorate. Neurons atrophy from underuse, synapses shrink, and the brain enters a hypoactive state that mirrors Alzheimer's disease. Correcting this doesn't require miracles. It requires medication review. Ask your doctor or pharmacist to evaluate your complete list of prescriptions, over-the-counter drugs, and supplements for their anticholinergic load. Online tools and professional software can calculate cumulative burden. Once identified, you can work on deprescribing, slowly tapering unnecessary medications, switching to safer alternatives, and rebalancing brain chemistry. Here's the most empowering aspect of this entire discussion. Drug-induced dementia is often reversible. When the burden is lifted, many seniors regain clarity, energy, and memory function within weeks or months. The brain demonstrates remarkable resilience, but only if given the opportunity. Polypharmacy isn't just dangerous, it's preventable. This makes it the #1 hidden medical threat to our aging population's cognitive health.